put Brendan right up to the plate here. He and I have spent the last several days in partnership with multiple other organizations nationally to attend the NCSL conference here in Boston. And we've had some really valuable takeaways, I think, over the last several days, meeting with legislators and partners and peers in the advocacy space. And so that is our focus for today, is 3 strategies for promoting MIH with state and local leaders. And Brendan, please, I'll let you unmute and take it away.
Hey, thank you so much, Dr. Vic. Everyone, thanks for being here today. Appreciate everyone's time. As Victoria said, we are here representing Mobile Integrated Health at this national conference of state legislators. And we are standing side by side with our other partner organizations in EMS, like the American Ambulance Association, the International Association of Fire Chiefs, National Association of States EMS Offices, the National Association of EMS Physicians, the American College of Emergency Physicians, the EMS Compact, the NAEMT, and the NREMT. So we are all in a collaborative group here and really promoting EMS and talking about each of our individual specialties. So really good opportunity for us to rub elbows with state legislators and to really highlight the importance of what we're doing in EMS, and certainly for us in Mobile Integrated Health, and provide education. We've really had some great encounters with folks over the last couple days. So we'll jump right in here. Next slide. Again, we're going to talk about some strategies for really promoting MIH programs with your state legislators. And I think, some of the insight that we're learning from the groups here and the folks who are decision makers at the state level is, listen for their problem, right? Like, what's the priority issue that they want to solve? So what are we coming to them with? And I think number one is really important. You need to adequately show how this program, your MIH program, is going to impact care, how it's going to impact underserved populations, how it's going to reduce total medical expense. This is a language that all of these state legislators speak. And going in and saying, we've got this great program that's going to be good for people and you should do this and help us with this, may get their attention, but it's probably not going to get this over the finish line. So it's so really, really important to be able to demonstrate that need. And the best way to do that is to use existing data in your communities to be able to show what that population looks like. An easy way to get data is to think about who are the key stakeholders in the community who are going to have data on patient populations in your community that you can use to your advantage. Well, first of all, every hospital every few years has to do a community needs assessment. You have access to that. They usually put these on their website, and that's going to show you what the patient population looks like, where the trouble points are, and where you may be able to fold a program into. Also, municipalities do community needs assessments on each of their communities. So again, you've got all of this usable data. Even if you haven't seen a single patient in your community, you've got the data available to be able to use that to craft your message, to demonstrate that need of why this program is going to be important. The next key strategy, which is a really important one, if we can go to the next slide, is, when you're talking with your state legislators, expect them not to have a clue what MIH is. As paramedics and EMTs, they get what we do, but most of them don't even understand the difference between an EMT and a paramedic. They just kind of either generalize everyone as EMTs or they generalize everyone as paramedics. So it's really important for you to think about how you prepare a message for that state legislator, to be able to say to them, here's what EMS is, here's what MIH is, and here's how it works. And it can't just be as simple as saying, we're going to take care of people in their homes. You really have to be strategic about this and really think about how in 3 minutes, because that's about the amount of time you're either going to have or that's the amount of time they're going to pay attention. With no disrespect to them, these folks get lobbied by people every single day based on what everyone else wants. So if you can't get that clear message out in 3 minutes, they may sit in front of you for another 10 minutes, but they may not be listening at that point. So make sure that you can do your boilerplate in 3 minutes and say, in our community, we have a problem with X. In our community, we have a resource available to help care for patients. And in our community, if we put these two pieces together in a program that can go out and help serve underserved populations, we can make a difference in the community. You have to be very strategic about your talking points, and you have to be very strategic about how you're going to ask for something too, which we'll talk about in a second. If you can't get that speech down, you're going to have a problem, right? Because you're not going to convey the message. And the more times you give the speech to the same group of people, the less they're going to listen. So very often we all have one opportunity with our legislators to get in front of them to deliver that message. I'll also say there's a couple other things here that are really important. Um, the concepts of mobile integrated health are so new to legislators and to many in the communities. There are things that you can do to help them really get on board. One of the things that we've played with is the ability to ask our state legislators to come out and do a ride along with us. Now it involves a HIPAA sign off. It involves a liability sign off whenever you get on someone else's truck. But having them come out into the community and see firsthand how you're impacting care or how you could impact care is really important. So let's say you haven't started a program yet, right? How are we going to do this? Well, if you're working for your local ambulance service, fire department, municipal EMS agency, and you're looking to start an MIH program, being able to take them out for the ambulance on the day, for a day, and say, this patient that we just brought to the hospital, we easily could have managed at home. And that would have reduced all the trauma that it takes for a patient, for instance, an elderly patient, to go to the hospital, to wait in a hallway, to be seen and then discharged at whatever time of the day. We could have easily assessed that patient at home, worked with our local primary care physicians or emergency physicians to manage that patient, and treated that patient in their home where they never had to leave their home. And then we direct them back to follow up with their primary care doctor, and you connect all the dots for them. And if you have that opportunity to get them out there, the work paints the picture and sells the process for you. And that's really important. And I don't want you to look past this, because it's not just for programs that are going to be new. It's also for programs that may want to try something new or expand their scope. Getting those state legislators out there with you or someone from their office to experience this firsthand will be invaluable in helping to promote your cause and promote your service. And then finally, the last one, next slide, please, is you got to figure out how you're going to fund this, right? Like asking them, one of the key insights from this is from here at the national conference is figuring out funding is not a strategy, right? Like we all talk about grants, and grants are great, and people will say, it does get you startup money, it gets you a lot of opportunity to build your program. But what we're seeing in this country is, grants being pulled away, grants being cut, the question about whether grants are going to be available, and figuring out funding is not a strategy. So you really have to define how your program is going to achieve sustainable funding. Now, that doesn't mean that if you can get grants to get started, that's a bad thing. It's not a bad thing at all. It's great, in fact. But if you can't hammer out during the course of that grant, when you have some money, or even before you get that money, how you're going to support this program and what you're going to need to sell that message, you have to be able to do that. Sustainable funding may be a stretch goal, as I said here, but should be your top priority. Because as I say all the time, the MIH cemetery is full of MIH programs that couldn't get to the point where they could sustain themselves. And you may be in a community where your community is going to fund this for some amount of time, and that's fantastic if you have that in your community. But at the end of the day, when dollars are down, when CFOs of communities start to look at where we're going to make cuts, it's always going to be programs that are not financially sustainable. So your first priority in getting funding is to figure out how that funding is going to help you get to a sustainable level. And there's lots of different ways that you can do this, but you have to have that information. And make sure, very important, that you have a path to that funding or an ROI or ask when you're speaking with these state legislators. The golden cow here for all of us is that if we can get CMS to pay for mobile integrated healthcare, it will change the game. But that shouldn't be the only place that we're looking. We should be talking with our local insurance companies. We should be talking with our local hospitals. We should be talking with any group of individuals that directly benefit from the work that we do in mobile integrated health. And you really have to step back and look at the customer. Is that customer your hospital system in your community? Is that customer your board of health? Is that customer a large insurance company like a Blue Cross and Blue Shield or a Kaiser Permanente? Who is going to benefit from the work that we're doing in the community, and how can we align with them to show them that we have a program that's going to improve access, that's going to improve outcomes, and is going to reduce costs? These are the three pillars, if you will, of programs that are going to be successful. So with that, I will stop for a second and would be more than happy to answer any questions that anyone might have.
Thank you, Brendan.
You're welcome.
Great
I do want to
insight.
point out also that on our website, on the NAMIHP website, there's a great guide on the how to get started advocating for MIH. You know, make sure you take a look at that guide. That gets a little more granular into how to start your program. Really important stuff, and it's a really useful tool. So please take some time, if you could, to take a look at that.
All right,
Thank you,
thank you very much.
Reg, I'll add on to this just for a moment while anybody is typing in questions or taking a minute to unmute here for any questions. So I do want to say that this guide was developed secondary to feedback that we got after our February summit. So at the February summit, there were a couple comments in the survey that talked about the need of resources if you're just getting started in MIH. And it correlated to our strategy here in advocacy this year. And so just know that your feedback matters, guys. And this is how we shape the focuses and the projects that we're working on. And this was born directly from feedback from you guys as members that you were wanting resources and how to approach local stakeholders. And so please do take a minute to check this out. And then I will say that this is my very first NCSL, and it really was incredible to see kind of these 3 steps in action. And I'll give an example, if helpful to everybody. You know, there was a moment where a legislator came and approached the EMS advocate section here, and we started the conversations with them around what are their priorities in the EMS realm. And through that, she was able to discuss the concerns in rural health about agencies closing down and the challenges that was going to create for gaps in access, et cetera. And, you know, our plan was to discuss the TIP, right? The TIP legislation with her and treatment in place and advocate for that. But if we had started right out of the gate with what we felt was important for them to know, it creates a gap in what they feel is the priority. And so allowing them to give some exposure about what their own priorities are, we were then able to correlate how treatment in place is a solution that can be leveraged for the purpose of access to care in rural areas, et cetera, and can really help to actually be a tool that is useful for them in their state. So it was great to see it in action. And thank you again for Brendan for helping to put this together.